Hi, I'm Dr. David Hill, and today we're going to talk about how to treat restless leg syndrome in toddlers. Now, restless leg syndrome is common in the population. It occurs in 2 to 3% of children and adults. It runs very strongly in families, so you might know that if you or your spouse has restless leg syndrome, your child may as well. It wouldn't be unlikely. Restless leg syndrome is sort of a sensation of crawling in the legs and needing to move them to gain comfort. It can be very difficult to describe, but your child may just say, my legs just have to move, or they may say they've got the wiggles. Now, there is a very similar and related syndrome that often affects the same people who have restless leg. It's called periodic leg movement syndrome, and that's just sort of a twitching that may occur as often as 5 times a minute during sleep. It may interrupt sleep. Fortunately, the treatments for these things tend to go together, as well as the patients going together who have these things. So in toddlers who present with restless leg syndrome, the first thing I want to know is, do they have iron deficiency anemia? Especially in kids who drink more than 2 cups of milk a day, have a lot of dairy products, maybe kids who don't have a lot of meat or other iron sources in their diet. Iron deficiency anemia can be common, and not only can it cause restless leg syndrome, but it can cause other developmental issues or behavioral issues. So if you think your child has restless legs, you might want to ask your doctor to just do a quick hemoglobin check or a quick blood count and see if perhaps your child is low in iron or hemoglobin. Otherwise, if it seems to be familial and the hemoglobin is normal, there are a whole bunch of medicines which have been tried. Some are somewhat sedative blood pressure medicines like clonidine. There are medications like Neurontin and gabapentin that have been used for seizures. Your doctor may or may not be familiar with them. He or she may want to call a neurologist or a specialist in sleep disorders to get some advice on how to treat it. That gets to be pretty specialized and pretty specific to the child, so I can't tell you exactly which one is best, but there are several options. It also means that if one's not working, you probably have some other things to turn to. So, talking about how to treat restless leg syndrome and, of course, periodic leg movement disorder in children, I am Dr. David Hill.